So I'm Dr. Rita McGuire, and I am the Chief Medical Advisor for Wakana for Life. So tonight we're going to talk CBD oil dosage. We're going to talk about each one of our products. We're going to really dissect really how you help your customer, your consumer, really start the product and how products to them, and how we can talk about all sorts of different methods of consuming CBD. I'm an obstetrician gynecologist, truly have been using CBD oils and products in my practice for the last 2 years, and really have seen a dramatic decrease in patients in really having that freedom to come off a lot of medication that they're on. So we'll start out with our disclaimer. These statements have not been approved by the FDA. Our products should not be used to treat, cure, prevent, or diagnose your condition. If you're nursing, pregnant, on medication, or under a doctor's care, always consult with your physician prior to consuming any nutritional supplements. So the first question is, how much CBD oil should I take? I got about 5 or 6 calls today, really helping our sales affiliates to figure out which dosage they really recommend for their clients. Rule number 1, there really is no one-size-fits-all when it comes to determining the right CBD dosage. The effective dose for each person truly is different based on your body chemistry, the severity of concern, your weight, the concentration of the product, etc. So 1 or 2 drops may be effective for me, but for someone like Tracy Bolton, she may need several drops of the same product. Rule number 2, I always start my patients low and I start them slow. That means that I gradually increase the dosage over time until I get the desired result for that person. So patience truly is the key. While some people get results immediately, most report not seeing results for weeks or even months. So this presentation will guide you on how to start and find your personal, what we call sweet spot dosage. But know that it will likely take some time and patience and really experimenting with the dosage until you find the best one for you. So what are the steps to finding your sweet spot? Well, first you need to decide how you want to take your CBD. There's different ways of consuming CBD. One way is using a CBD oil drop that you place under your tongue and allow that oil to absorb directly into your bloodstream. This really is the most popular way that people take CBD. Another way is vaping. It's the second most popular way of consuming CBD. It's really preferred by those who are really looking for a quick relief from anxiety, panic attacks, and even migraine. Other popular methods include oral capsules, gummies, topicals, and transdermal. Those are what are typically applied to the skin. So the next slide shows the importance of placing the oil underneath the tongue and the floor of the mouth so it can be absorbed in the bloodstream. It's important to hold the oil for 60 seconds. So by the time you swallow, there should be little oil left because it is already consumed, absorbed. Another very popular method is topicals. In fact, that Wakana has a topical cream called Power Relief, and it contains CBD with 0.3% of THC. It contains other essential oils like eucalyptus, menthol oil. It's an amazing product. You just need a little to place on the area of relief. I work every day, and I tell you, today I think I opened it, and my biceps were so sore. I used just a little bit of our top cream on my bicep muscles, and I'm telling you, within 25, the relief from that muscle pain was all better. So you just need a little. Our relief is 200 milligrams in a 15 ml jar, and it was a great relief to know that you don't have to take Motrin or Aleve or Tylenol or any over-the-counter pain medications to alleviate your pain when you can use a topical. Consider how the chosen delivery method impacts dosage. Well, the way that we talk about that is the word bio. Bioavailability refers to the actual amount of CBD that gets into your bloodstream. It's estimated that about 20 to 30% of CBD gets into the bloodstream when you use the drops. It's estimated that about 30 to 40% is in the bloodstream when you vape, about 5% if you eat a gummy, and about 98.7% when you talk about our nanotechnology. So, for example, consuming 25 milligrams of CBD in a sublingual drop, that means you place it underneath your tongue, is about 4 to 6 times the amount of CBD when you use a soap or a gum, 25 milligrams. Now, no matter what method you choose, it's important to understand if it's a very low dose, a very high, it won't give you the best chance of success. Meaning, if the dose is too low, you're not going to feel any effects at all. And if the dose is too high, which I see a lot of people using too high of a dose, then you may experience some undesirable results, nausea, or even a general worsening of the symptoms that you are trying to abate. So it's really important to figure out what that sweet spot is. So the recommendation to get to the optimal dose, so the recommendation that I always use in my practice is start low and start slow. What you want to do is you want to end up on the left half of the bell curve that you see in this picture. You want to start low and start slow until you find that optimal dose. You can also expect to need to make adjustments over time to remain in that optimal range. This is why experimentation is key. So now let's discuss some different methods that we use to find that optimal dose by each delivery method. So we'll talk about the tincture, that is placing the drop underneath the tongue. So there's no right way to determine that optimal dose, but here are a few methods that I use that really helps people to be successful. We're going to talk about microdosing. This is a great chart that I'm going to put on Wakana for Life Facebook page. This is a chart that you can use. You can chart when you took the dose. You can chart the product you use. You can chart the amount or how many drops you use. And then on a scale of 1 to 10, you can, 10 being the worst severity of pain that you're trying to alleviate. And then you can then chart the relief level. So what is your pain or severity after the dose? And then you can chart the time you achieve that relief. So this is a great microdosing chart that you can use if you want to microdose. The other way of finding your sweet spot is decide on the number of milligrams of CBD you want to take. And there's a great chart that you can use, and this chart is based on the severity of the condition and the size of the person. So you can look at your weight. Let's say you're 160 pounds and the severity of arthritis is pretty severe. So that would put you at 27 milligrams a day of CBD. So once you've determined that target dose, then you got to figure out how many drops that is to get to that dosage. So we're going to talk about how many milligrams each drop is in our products. Again, I recommend starting low and starting slow. If you are new to CBD, you want to start about half of the suggested dose and then slowly increase until you get to that recommended dose every 3 to 4 days. So the right dosage, again, is different by person and product. We all metabolize CBD very differently, but this is a chart that you can use if you want to use a target serving size. The other way to find the sweet spot is actually following the instructions on our bottles. You can use our suggested recommendation. Let's look at our Wakana powered by Hempranium. This is our product that is 500 milligrams. Each drop is 1.67 milligrams. So if you're looking at the chart and you're trying to figure out how many drops it would take to get to 27 milligrams, well, you know that each drop is 1.67 milligrams. So you can do the math on that. This product contains 0.3% of or less of THC. It is also infused, or we add peppermint, turmeric, and it's black seed, and it's in a carrier oil of MCT coconut. As you can see on the bottle, we recommend for mild conditions 6 drops a day, for moderate conditions 15 drops a day, or severe conditions 30 drops a day. So when you do the math, 30 drops a day will give you about 50 milligrams of CBD. Great about our endocannabinoid system is that we really don't need a lot of CBD. That's why I love microdosing. I love starting low and starting slow, because more is not better. Now, our Wakana Power, our Black Power, or our tincture, or our baking, this is a product that is great because it is dual usage. You can use it as a tincture, meaning you can put it underneath your tongue, or you can bake with it. This product is 500 milligrams. It comes in a 15 ml bottle. Again, each drop is 1.67 milligrams. So you can do the math and figure out how many drops are good for you, or you can follow the recommended dosage on the bottle, which is for mild conditions, 6 drops a day, for moderate conditions, 15 drops a day, and for severe conditions, 30 drops a day. This particular product is great for those people who don't like any flavor in their CBD oil. That's why it only contains the CBD with 0.3% or less of THC and the carrier oil. It's great for baking because it doesn't have those extra flavors and ingredients. The next product is our Wakana Power. Again, this is a water-soluble product. And what that means is that the product, the oil, is converted so that more bioavailable, as it has to not go through that first pass effect. So it doesn't have to go through the stomach. It doesn't have to be metabolized to the liver in order to hit the bloodstream. The water soluble is a product that you can use orally. You can place it in your water or your food, and it becomes bioavailable to the bloodstream very easily because of the conversion of the oil to a water-soluble particle. Each drop, again, still is 1.67 milligrams per drop, so that you can figure out if you want 27 milligrams that we showed in that example on a 160-pound person. You can figure out the math on how much you have to add to water, to food, to mocktails for someone who has a severe condition and is 160 pounds. Now, our Wakana Nano Hempranium is going to be coming very soon. It will be available, but this is a product that is a nanotechnology, which means that the CBD molecule is, again, made more water soluble, so it's more bioavailable to the cells. It's 98.7% bioavailable to the cells. So you're talking about a product that truly is more available, so it's going to be definitely a product that is used for someone who, one, does not want the THC. Our nano removes the THC. Two, it's a product that has the additional essential oils like black seed, peppermint, and turmeric that address inflammation. And three, it's a great product for those who undergo random drug screens and don't THC in the product. This product, again, can be used by following the recommended dosage on the bottle. The recommended dosing is for mild conditions, 6 drops a day, for moderate conditions, 15 drops a day, and for severe conditions, 30 drops a day. Now, I recommend that you divide the dosage in an AM and a PM dosing schedule. So if it's 6 drops a day, then you should do 3 drops in the morning and 3 drops in the evening. Again, this product will be coming soon. It is a 300 milligram concentration in both a 5 ml and a 15 ml bottle, which equates to 1 milligram per drop. We see again our Wakana Pure water soluble. This is an amazing product. Our water soluble product is 2,200 milligrams in a 15 ml bottle and 650 milligrams in a 5 ml bottle. That equates to 7.4 milligrams per drop. Again, depending on the severity, depending on the weight, you can either target specific, you can use the recommended dosage on the bottle, or you can microdose it. You can use just a little, 1 drop, wait 45 minutes. If the desired result is not apparent, then you can add another drop. But definitely with the Wakana Pure water soluble, you just need 1 or 2 drops that you can place in your beverages, your food. And what I love about water soluble products, you can use them orally. That means that you don't have to place it underneath your tongue like a tincture. Let's talk about a different method delivery of vaping. Vaping is very, very popular. Getting the right dose when vaping, though, is harder than using it underneath the tongue. Vaping is different. You take maybe 1, maybe 2 hits at a time and then wait a few minutes. If you haven't gotten the release that you want, then you can take another 1 or 2 hits until you do. So vaping is great, again, because it addresses acute issues, acute pain, acute anxiety, acute migraine, whatever it is. Vaping's onset of action is within 30 to 60 seconds. Our vapes are 200 milligrams. They're a half ml cartridge. About our cartridges is that they are sealed, so you can't add anything to them. The physics of the coils are specific. They're specifically structured for our oil, so we don't want you to add anything. We're offering power vapes that contain 0.3% or less of THC, and our pure vapes that contain 0.0% THC. Again, 1 to 2 puffs is really all you need. I would wait 30, 45 minutes until you take another 1 or 2 puffs to make sure that, you don't overdo it. The other methods of delivery are gummies. We offer our gummies. And gummies, as I mentioned earlier, the bioavailability is much lower than vaping or using the tincture. But on the bright side, you don't have to figure out how many milligrams you're consuming, right? You know exactly from the package that our gummies are 25 milligrams. It's really important to know that when you're consuming gummies or capsules or anything that's consumed orally that is not water soluble, it's going to take about 45 minutes to an hour and sometimes 90 minutes to see an effect from a gummy. So start low, start slow. Take 1 gummy. We have gummies that contain 0.0% THC. The entire package, you'll get 4 in the 4 package. Our gummies are vegan, which I love. They don't have the extra sugar and all those toxic chemicals that you see in other gummies. They come in different flavors, and they're very, very affordable. Our power gummies, again, on the packages, it's labeled 25 milligrams. The THC is 1 milligram, again, under the 0.3% THC. Our power gummies are full spectrum. Again, use 1 gummy at a time. I would wait with these power gummies. The testimonies that we're getting from the power gummies are amazing. They're improving libido, they're improving pain, and they're really allowing people who have insomnia to sleep. So again, this is really our lineup. I think what's missing in this picture is our vape cartridges. But our power line, again, you see our water soluble that is powered by hempranium, our power culinary oil, and then we have our Wakana pure water soluble, our Wakana pure hempranium, which is coming soon, our power release topical cream, which is amazing. When I tell you that my biceps were on fire this morning, and just a little bit of that cream has taken that bicep strain away. We will also be offering the 20-count gummies in our power and our pure, as well as our 0.5 ml vape cartridge. So that is the end of my presentation.